Hi, this is Mark Porter for Kinesiology 353, Care and Prevention of Athletic Injury. This is assignment 1, ankle taping, and we're going to also go through some of the rehabilitative processes for a grade 2 inversion ankle sprain. This is my assistant for the video, Rosie.
Hello.
She's going to demonstrate some of the rehabilitation process and the exercises involved, and she's also going to be a model for the ankle taping that we're going to perform here in just a minute. All right, for our closed basket weave ankle taping, we're going to need 1 roll of pre-wrap and 1.5 inch adhesive tape. We want to first apply the pre-wrap so that we can avoid any skin irritations that could be brought on by multiple days of taping to immobilize this inversion sprain. We're going to start with an anchor strap on the top and the bottom of this. We're then going to alternate a stirrup strap working medial to lateral for our inversion sprain, followed by a horseshoe strap that's going to start here medially on the inside, go around the medial malleolus to the back of the heel, and finish laterally here on the top of the ankle, and then back to our stirrup straps. As we alternate straps, you want to overlap to about the halfway point of each piece of tape. We also want this closed basket weave to be sturdy and supportive, but not restrictive to any type of blood flow. So it's always good to check with our patient or athlete and make sure that they let us know if anything is too tight.
Not too tight.
All right, thank you. So we've applied 3 stirrup straps. This is our 3rd horseshoe strap. Now we're going to continue to go around and clean this up. Taking as best care as possible not to have any creases or wrinkles in our tape, so that we can avoid blisters or excessive irritation. And it is okay that this initial taping is a little bit tight, because as the athlete moves around with it on, it is going to loosen up a bit and does still allow for range of motion, slight range of motion to take place. We'll finish with a heel cup. That first one, we started medially, came around and finished medially. This next one will go laterally. That's it. Just smooth out any wrinkles. And you have a closed basket weave ankle tape. All right, so we've just gone through and done our ankle taping, and now we're going to work on some of the restorative exercises that we can implement starting the day after injury takes place. As long as there's not a great deal of pain associated with this, we can work on this isometric contraction. And really, if you want to remove your right slipper, so we're only going to work in the sagittal plane of motion here. She's just going to flex at the toes, making a gripping motion, and then extend, spreading the toes out as wide as you can. So as you extend, try to go ahead and spread them like if you were spreading the fingers of your hand open. There you go. So this, she's going to try to keep her ankle neutral as possible. So avoiding any excessive plantar flexion or dorsiflexion. She's going to do this 10 to 15 repetitions every hour, as long as she's on her feet walking around. So it's not uncommon to see an athlete be on crutches for 5 to 10 days following this type of injury, the grade 2 ankle inversion sprain. So we're really limiting motion, we're really limiting range of motion when we do this, and we're also just trying to allow as much healing to take place as possible in the form of reduced swelling and immobilization. So this little bit of movement is going to add to proprioception, it's going to enhance neuromuscular control, and it's going to help her regain strength through this rehabilitation process. So again, this can take place starting the day after injury. We mainly want to focus on rest the first day the injury takes place, as well as ice compression and elevation. But we're not going to introduce any sort of exercise in the beginning of a grade 2 type of sprain. A few days after this takes place, the swelling starts to reduce, pain is reducing as well. We can work on increasing range of motion through circumduction. So she's going to go ahead, extend your leg again, go ahead and point your ankle forward in plantar flexion, and you can start rotating through all 3 planes of motion. So she's going to do this 2 to 3 times per day, 10 to 15 repetitions in each direction. And as you can see, Rosie is working her ankle through all 3 planes of motion. So she's working the frontal plane, sagittal plane, and the transverse plane horizontally. So she's increasing full range of motion that would normally be seen in her daily activity. So again, this exercise is going to help increase range of motion. It's going to increase strength, neuromuscular control, as well as proprioception, so she's able to tell kind of where her ankle is relative to the space around her. So there are also a number of other exercises that can be performed. It's quite common for this type of injury to take place, for the recovery process to take place anywhere from 3 to 4, even up to 5 weeks, depending on the severity of the strain. Usually it's not going to be a complete rupture of the ligament, the calcaneofibular ligament that takes place on the lateral aspect of the calcaneus, connecting the lateral malleolus on the distal end of the fibula. So as we went over earlier, the closed basket weave taping does help offer support to immobilize that joint while recovery is taking place. So I hope this video was informative and helpful. Thank you.